Good afternoon, everyone. Thank you for joining us here today. My name is Twin. I am from the Community Health Resource Center. I help coordinate our health education program. Community Health Resource Center is a nonprofit that's been around here in San Francisco for over 30 years. We are closely affiliated with California Pacific Medical Center. We provide 4 primary areas of service: nutritional counseling, mental health services, health screenings, and free health education, which you're participating in right now. Before we get started, I'd like to make sure that everyone knows how to interact in this webinar. As you might have noticed, you're all muted. Only the people who are able to talk are the panelists and the host. If you'd like to ask a question, you can navigate to the toolbar at the bottom of your Zoom window where there's chat, participants. If you click the control down the line, there's Q&A. You click that, you can ask your question by typing it in, and that's how we'll know what sort of questions to answer as we go, or if we're going to save them all by the end. That is actually when we prefer to answer live questions. Elena, our speaker, will be going through the presentation, and if there are questions that are more urgent and that you'd really like to, for example, specify something on a slide that she's going to pass, then you can definitely raise your hand virtually. You can raise your hand by clicking along the toolbar where the chat control is also at. But if you have the mobile app, then you're looking for 3 little dots on your screen somewhere, and when you click it, a drop-down menu will appear, and you can choose to raise your hand or even chat. So far we've gone over Q&A, we have gone over raising your hand virtually, and then lastly, there's also for you to chat to the panelists or the participants. I think it was mainly just the panelists or the host. So for you to communicate with us outside of Q&A and outside of just virtually raising your hand, you can also send us direct questions or messages. I will be able to see them, and I'll understand that you want this urgently addressed, and I'll let Elena know. Also, the purpose of virtually raising your hand is that we can unmute you and you can ask your questions out loud. However, I do want to encourage you to save your questions to the end if you can. And that is that's just all about I have for the tour for this virtual Zoom class. I will then now pass it on to our sponsor, National Kidney Foundation. You might have seen in the marketing that this class is actually $180 per person, but it's made free through National Kidney Foundation support. And here we have Patty McCormick, who is the program director here in San Francisco.
Great. Thank you, Twin, and welcome everyone. We're honored to be partnering with the Community Health Resource Center to offer this workshop. As attendees, you are in for a treat and some excellent education on kidney health and nutrition with Elena as your guide. A little bit about the National Kidney Foundation. We work hard to support, educate, and advocate for all those dealing with kidney disease as well as those at risk. This includes patients, their loved ones, health professionals, and living donors. And the National Kidney Foundation is a voluntary nonprofit health organization, which means we rely fully on volunteers to help us fulfill its mission, and we are so pleased to be able to not only do that, but provide education to you through this program today. Next, the resources for the National Kidney Foundation. It's important to know that these resources are available to everyone and they are free of charge. The NKF Cares is both a helpline, a telephone, and an email, and the health professionals that are there answering your queries do so both in English and in Spanish. The Peers program is for those of you who might want to talk to someone who's going through the same stage of kidney disease as yourself, and that information is there. And then we also have online communities, and this is for those of you who are more comfortable connecting with others online. And with that, I will pass it off to Elena, and thank you so much.
Thank you, Patty and Twin, for the introductions. So my name is Elena Zidaru. I'm an outpatient registered dietitian with the Community Health Resource Center. And actually, I've been worked for the Community Health Resource Center for the past 8 years now. And part of my work, I mean, I guess the bulk of my work, I should say, includes one-on-one nutrition counseling for different conditions. I work with both kind of preventative and disease management. So I work with people for weight management to help them lose weight and prevent, maybe they have prediabetes, high cholesterol, and this will help kind of avoiding getting diabetes or cardiovascular disease. Also, I do a lot of more specialty work, working a lot with people with cancer and gastrointestinal diseases. Of course, diabetes management, cardiovascular disease, sometimes people after a heart attack or a stroke, they meet with me. So a lot of my work is just one-on-one, and I'm trying to tailor and individualize that nutrition advice just based on where people are in their life, what's feasible for them to do in a way to, again, help them manage or prevent diseases. Sometimes I participate in the health education part of the Community Health Research Center, and I'm a presenter and I talk on a topic that most of the time is important for me. What happened and how I got into doing the CKD, chronic kidney disease, presentation is about last year at the Community Health Resource Center. We decided to focus more on awareness of CKD. A lot of people may not know that they have CKD or they're at risk for CKD, and we wanted to bring awareness not just to people and potential patients, but also primary care physicians to recognize the CKD into the earlier stages, when actually with nutrition interventions you could slow down the progression of the disease. So we have 4 dietitians at CHRC that do nutrition and counseling, and 4 of us talking throughout the years about how common sometimes it is that people with CKD, maybe stage 4 or 5, more advanced, they were not aware that they have this happening, a decrease in their kidney function for years, and they get very frustrated. So they were meeting with us more at stage 4 or 5, even when they had to about dialysis, and we just felt like would be so much better if chronic kidney disease was something recognized and diagnosed earlier on, when people were able to, as I said, change their lifestyle, their diet, their activity level in a way to avoid getting into those more late stages. So this is how we got into created this class series, and also we did other, we got involved into other programs just to kind of create more CKD awareness. I would like to kind of start by having a description of the agenda. So those, for those of you that are not aware, there are 3 consecutive presentations or classes, what we call. So one is today, the next one is next week, next Tuesday, the 25th, and then the last one would be September 1st. And that would be actually, today, our agenda will include basic kidney function, more information about what are kidneys, how do they work, what is the main role of kidneys in our body, just to kind of understand how the future information about and more detailed information about nutrition in next week and in 2 weeks from now would actually help with managing CKD. I wanted everybody to kind of get familiar with the risk factors of CKD, with stages of the kidney disease, and again, the nutrition approach, it's a little bit different based on the stage you're gonna be. And at the end of today, so even though we're not going to get too much into in too many details about diet and nutrition, I'm going to give you a healthy diet recommendation overview, and there are going to be some parts in the presentation where we're going to talk a little bit more about diet, but it's not going to be only diet today, but I promise you next week and the last class are going to be just focused on that primarily. So I wanted to get started with how do the kidneys work. And so we have 2 kidneys in our body, and they're kind of a bean-shaped type of organs that they're right below your rib cage, and they're more kind of in the back of your abdominal area. They filter, their capacity to filter blood is amazing. So they filter about 120 to 150 quarts of blood in a day. And so out of that, they filter waste material, what we call urine, that's about only 1 to 2 quarts. So think about, you process 120 to 150 quarts of blood, and you just kind of select 1 to 2 quarts to get rid of. So there's a lot of reabsorption and recycling that happens, and they do that quite efficiently when they work properly. You also have a little bit, and I'll show you with my cursor here. So those are your kidneys, and each of them, they have the ureter that's connected with the bladder, so from both sides, and that's where the urine is accumulated and stored until, you know, gets full, and we need to kind of our body needs to get rid of it. There's this kind of dissection of the kidney to show you how it looks inside, and the blood enters from the renal artery into the kidneys, and all those, there are about 2 million nephrons, which are very kind of small components of kidneys, that they have this amazing filtration capacity, and they're gonna filter all that blood that enters to the renal artery. And that's gonna basically be collected and transformed into urine and eliminated in the ureter, right? That goes back to your bladder to be stored, to store the urine. And then the blood that's waste-free gets recycled back and filtered back into your body through the renal vein. So this is kind of happens, and again, 120, 150 quarts of blood gets filtered every day through this mechanism. This is a little bit of a closer look to how those nephrons, they have a glomerulus here. Remember I said there are 2 million or so of nephrons in each kidney, and glomerulus, this is kind of basically a bundle of it's like, I imagine it as a very dense sieve where there are lots of tiny vessels, those capillary, where the blood kind of flows, and again, the good nutrients are filtered back and recycled into your blood, and the waste material, which forms into urine, kind of circulates through those tubules, and then ureter, and in the bladder, and then out of our body. So this is what happens. And here, I'm not going to read everything again because I just described, but on this slide, I would like to talk about the main functions of the kidneys and the main role of the kidneys in our body. So why are they important is because they really keep the blood composition stable so that our body can function properly and normally. You know, we have probably heard about pH, which kind of measures acidity, alkalinity. You know, a neutral pH is it's 7. And a lot of times for our blood, in order for us to survive, it's a very narrow pH range that we need to maintain. And our kidneys have an important role to maintain that narrow pH range. So if we eat something too acidic, your kidneys will filter and get rid of too much acid. So then they put back some alkaline substances. So then they help balance that acidity that we just consumed so that the pH stays within that narrow range. And it's the other way around. If you eat something too alkaline or drink something too alkaline, then your kidneys will, you know, will balance this. So then the pH is always in the blood in the same range. It keeps the balance of electrolytes. Probably you heard about electrolytes. Let's say when we sweat too much on a hot day like today, where I am, it's very hot. Or let's say we have diarrhea or vomiting. A lot of times our body loses sodium, potassium, phosphate, chloride. And so the kidney's role is that if we lose too much, they may be able to absorb more back, so we keep that balance. Sometimes we need to replenish with electrolytes because you know, we lost too much, and again, those electrolytes keep us, the balance of electrolytes keep the balance of fluid in our body, fluid inside the cell, fluid in the blood, fluid outside the cell, and everything needs to be in balance. Another role would be they make some hormones, and one of them is involved in the blood pressure regulation, and another one is involved in the red blood cell production. So, for example, we need red blood cells to be able to carry oxygen in our blood, oxygen that's needed for all the cells. So it's very important to have enough red blood cells. When people don't have enough red blood cells, they become anemic, they become tired, they don't, you know, their cells are not getting the oxygen they need. So sometimes somebody with chronic kidney disease, that their kidneys are not functioning well to produce this hormone that produces red blood cells, they actually have this chronic anemia that's happening, and oftentimes they need to inject themselves with this hormone to produce red blood cells because their kidneys are not doing that job anymore. So two hormones are important that are secreted by, made by kidneys, one to regulate blood pressure, which obviously it's very important, and also the red blood cell production. Another, one of the last and as well very important role is to activate vitamin D, which maintains calcium for bones and in your body. So vitamin D, usually we synthesize it in our skin through sun exposure, and then it kind of, something happens in the liver, but the kidneys are the organs that will activate that vitamin D. So then our body can use that properly. And vitamin D is important to keep that balance of calcium in between our blood and bones. So we want to make sure we're not leaching calcium out of bones to put ourselves at risk for osteoporosis. So as you see, kidneys have different roles, but pretty important, but they're involved in a lot of, you know, blood pressure, electrolyte balance, and bone health, and blood cells production. I wanted to go a little bit over two types of kidney disease that we hear or we know about. So there's the acute kidney disease, which sometimes it happens because sometimes it happens from when people get, they have an infection in their body, or sepsis, when your whole body is fighting infections. It can happen sometimes from drugs, something that kind of is perceived as toxic in your body, and your kidneys will filter that. So it's something that happens acutely, and you know, it can be scary because basically all of a sudden you had healthy kidneys, but all of a sudden those kidneys are failing and they're not doing their job anymore. Early detection and appropriate treatment can basically cure kidneys and the acute kidney disease and reverse it, you know. So you're able to have your kidney function bouncing back, even though momentarily decreased for whatever reason, what I just mentioned. But you can retrieve and actually you can regain that kidney function with appropriate treatment, and everything kind of can get back to normal. We also then have the chronic kidney disease that the kidney damage cannot be reversed. So this is more a slow progression of, or a slow loss of kidney function. And this usually happens more in time, not all of a sudden like the acute kidney injury. It happens in time and slowly and gradually, but unfortunately, as I said, we cannot reverse it. That's why it's very important to catch it and recognize it as early on as possible, so we can actually, with lifestyle measures, but also medication, we could actually slow down the progression of it and just keep it at the level that it is, at the stage that it is, and not allowing it to progress further. Moving forward, how you detect kidney disease, we have a blood test. Usually when kidneys are kind of showing signs of not working properly, blood creatinine, which is something that we can test in our blood, so that increases, so it's higher than normal. And the glomerular filtration rate, what we abbreviate GFR, decreases. Because think about it, that means the filtration rate and the filtration capacity of your kidneys is declining. So you're losing kidney function as the creatinine rises. Those two, so the glomerular filtration rate, we abbreviate GFR, as I said, and those two are part of your comprehensive metabolic panel, which is a standard blood test that with an annual exam at your doctor, you can always get this tested, your kidney function. So this is something to kind of look for. There's also a urine test that basically they can test in a urine, so it's a less invasive kind of test. With the urine sample, they can test the presence of protein and or blood in urine. So what happens, sometimes individuals, they have healthy kidneys, the creatinine is not increased, the GFR is not decreased, but they might show protein in the urine. And protein in the urine, even with the normal GFR, as I mentioned, may indicate an increased risk of developing CKD, and it can be actually as one of the first signs of decreased kidney function. As I said, even though this GFR is not at this point low, but it can may indicate an increased risk of developing CKD. So it's something to watch for. Those at risk, and we're gonna talk pretty soon who are people at risk of developing CKD, but those at risk for sure should have their protein in the urine checked annually. Because as I said, sometimes the GFR looks good, but if you have protein in the urine, that can show some early sign of decreasing GFR. I want to go over symptoms of CKD, even though we're not going to spend a lot of time on this, but just because most people actually may not have any symptoms until their kidney disease is quite advanced. And a lot of times those symptoms are, again, for people that are already quite advanced. So at early stages, like 1, 2, 3, most people won't have any symptoms. However, again, just to be aware of those can include feeling more tired or having less energy, having a poor appetite, not being able to concentrate much, some muscle cramping at night, not being able to sleep well, swollen feet and ankles just because you accumulate more fluid, your kidneys cannot get rid of that efficiently. Again, that can be likely on more advanced stages. Puffiness around your eyes, especially in the morning, some itchy, dry skin, and also the need to urinate more often, especially at night. So those can be the symptoms, but as I said, oftentimes those appear more in the late stages. So our definitely talk, I differentiated between this acute acute kidney disease or acute kidney injury, and then chronic kidney disease, and our focus is chronic kidney disease. It is a gradual and progressive loss of kidney function over time, the way I shared with you. The same with diabetes and high blood pressure. It's named the silent killer because oftentimes has no symptoms in the early stages. Now, the main risk factors for CKD are actually high blood pressure and diabetes. And about half of the individuals with CKD, they also have diabetes and or self-reported cardiovascular disease. Definitely, there are other kidney diseases or kidney conditions that can increase the risk of CKD and can lead in time to CKD, like glomerulonephritis, so it's kind of an inflammation, polycystic kidney disease, lupus, which is autoimmune disease, sometimes obstructions that are caused by kidney stones or tumors or enlarged prostate gland in men. Also very frequent or repeated urinary tract infections, but those are not, as I said, commonly necessarily leading to CKD. The bulk of the CKD cases will be people with high blood pressure and diabetes. And at least for for those of you that kind of know how diabetes work, in a way, it makes sense because diabetes, we know uncontrolled diabetes. So when people don't control their diabetes and their blood sugar, it's too high, the uncontrolled diabetes can damage small vessels of blood and big vessels of blood. So, you know, somebody with diabetes has higher risk of developing a heart attack, for example, or cardiovascular disease, or having a stroke, because those big arteries can be affected. The same with small blood vessels, like the ones that I showed you, the capillary, the very tiny blood vessels in the glomerulus, in the kidneys. So those can be affected too. And the way I look at it is that, as I said, those nephrons and those glomeruli that are part of the kidneys, the filtration kind of machine, I look at it and I think of it as a very dense sieve that can filtrate very well. When you kind of start having holes in the sieve, then things are kind of leaching in the urine, things are not able to be filtered back into your blood. So the filtration does not happen as well. And high blood pressure can cause the damage to the glomeruli, because think about if you have a lot of pressure coming into those small vessels, those can actually get damaged in time. I have next risk factors for CKD, and as I mentioned, diabetes, high blood pressure are at the top, and those are part of the controllable risk factors because we can control those diseases. Somebody with diabetes can have close to normal or normal blood sugar levels. Somebody with high blood pressure, they can have normalized blood pressure, and both can happen with medication and or most of the time, and I would say lifestyle modification. So diet, exercise, stress management, improved sleep, and taking medication as needed can allow you to control both your blood sugar if you have diabetes and blood pressure if you have high blood pressure. And the key is actually to control those, because if you control them, even though you have them as diagnosis, you're not necessarily going to develop CKD, chronic kidney disease. The chronic kidney disease mainly happens when those are not well controlled, and the way I explained will damage those vessels in the glomeruli. Heart disease and obesity would be also risk factors that are controllable. The non-controllable risk factors will be the family history of CKD. Like anything, if you have a family history, obviously you're at higher risk to develop a disease. Age over 60, like anything in our body, the older we get, things are not working properly anymore. And race. And there's certain populations that are the higher risk to develop CKD. African Americans, Asians, especially in the Filipino community, they're at higher risk of developing CKD. But again, those are non-controllable. So we always need to focus on the controllable factors and what we'll be able to do to prevent CKD or slow it down. I want to talk a little bit about blood sugar control, since the majority of the main risk factors for CKD are diabetes or I should say uncontrolled diabetes and uncontrolled blood pressure. I wanted to talk about how you control blood sugar and how you control blood pressure as basically from a lifestyle nutrition standpoint. Of course, there's always medication, and I have it here at the top. You take medications as prescribed by your doctor. That's very important, because sometimes, depending on the circumstance, just the diet alone or lifestyle modifications alone may not work or may not work as well. So you need help. Sometimes people are actually able to take less medication because they're doing pretty well with their lifestyle, and that's still a good, I think, a good compromise. It's important when you have, let's say, diabetes and you need to control your blood sugar. Well, it's important to monitor as closely as possible and as directed by your doctor, because this is the only way that you will have a reassurance that the more often you monitor and you see those numbers are within good ranges, it's like you have this confidence that you're doing a great job with controlling your diabetes. If you just check your labs maybe twice a twice a year, even though sometimes the numbers may look good, it still doesn't give you a clear snapshot how you do most of the time, you know, so you need to monitor more closely. In terms of diet measures that you can take to control better your blood sugar, it's very important to eat regularly. So we say try to eat within the first hour of waking up and about every 3-4 hours thereafter. It can be 3 to 5 because we're all different, an average of 4 hours. So that will match more the physiological response. So when we eat, it takes about 4 hours for our blood sugar to drop again, because we need some time to process the nutrients for those to be available in the blood and some time for that blood sugar to drop again, so we're ready to eat again. So when you eat regularly, you basically have a nice wavy way of blood sugar in your blood sugar will be nice and wavy and evenly kind of control, and you avoid the spikes, the ups and downs. When you create gaps in between your meals, not having sugar from your food, from your carbohydrates, to help you create blood glucose in your blood and allow the cells to use that as fuel, your body will have to make sugar, you know, make sugar from protein and fats, and then it becomes this kind of imperfect process of maybe your blood sugar, you allow it to drop too much because you haven't eaten, and then maybe you're eating too much and then you spike it, or maybe your body will try to make sugar out of protein and fat and will release too much sugar or will have too much sugar available at one time. So you create this roller coaster up and down of a blood sugar pattern, as opposed to nice and wavy type of effect that when you eat regularly, this kind of what happens. Another measure to control better your blood sugar would be actually to balance your carbohydrates. Those are the foods that eventually will turn into sugar when they get digested, or they turn into what we call blood glucose, which is the same thing. And when you eat the carbohydrates with protein and fats, and I would say also with fiber, all those three will have the ability to slow down the absorption of that sugar in your blood. So what happens, basically, I would like for you to picture a jar of sand, with sand being the small sugar molecules. Once you actually, when you're trying to empty the jar, all that sugar, all those small molecules will just flow easily, and they're all going to get released into your blood. Now think about, you have a jar of sand and you have bigger rocks inside that jar of sand. The bigger rocks are the protein, the fat, the fiber, and the sand is still the sugar, small sugar molecules. Now you're trying to empty that jar, it will take longer to empty. the protein, the fat, and the fiber will slow down that sugar. So, and then basically that sugar will take longer to be absorbed into, will be released in time into your blood and won't spike your blood sugar all of a sudden. And that's happening, let's say, if you eat just big bowl of white rice with just maybe a little bit of chicken, some protein, but not much, right? As opposed to I'm eating half a cup cooked rice with a 3-ounce chicken and a big salad or some cooked vegetable, half of my plate. So now I added the fiber, significant amount of protein, some fat to that meal, and that rice, first of all, is not as much to spike my blood sugar, but also would be buffered by those protein, fats, and fiber. So it's very important, and I would like to mention that in order to manage better your blood sugar if you have diabetes, the key is not to avoid eating carbohydrates. It's actually to eat a controlled amount of carbohydrates throughout the day and pair them with protein, healthy fats, fiber from vegetables. And that would be a better way for you to manage your blood sugar than, let's say, not eating carbs at all and taking them all out. There are also definitely some carbs are better than others, what we call more complex carbohydrates, as opposed to more refined, the ones that can break down very fast in sugar molecules and can be available all of a sudden in our blood to spike our blood sugar. So that would be, let's say, white bread, white rice, desserts, you know, those simple sugars, as opposed to complex carbs like a whole grain, maybe your brown rice or your quinoa, maybe legumes like beans, dry beans, or sweet potato with skin, those starchy vegetables or peas, or even fruits. So those actually are going to be more complex carbohydrates, and the fiber will slow down the absorption of their sugar. I have here, I mentioned that if you choose whole grains when possible, they digest slower, so they take more time to become sugar and be absorbed in our blood, so you minimize your blood sugar spikes. The key is also, as a diabetic, to limit the amount of refined carbohydrates and simple sugars, and really kind of, when you eat them in small portions. Again, pair them with some other fiber. Let's say you eat white rice, but if I'm eating a small amount of white rice and half of the plate vegetables, non-starchy vegetables, or salad, you know, that will give me extra fiber to help minimize that spike. So kind of limiting refined carbohydrates or even eating small amounts would be good. The same with simple sugars, anything that's a dessert or a sweetened beverage. So anything that would not need any chemical digestion would be just kind of sugar that will be absorbed from your intestines into your blood quite fast. Exercise regularly, it's an important measure to lower your blood sugar or control your blood sugar. I wanted to kind of take a little bit of time to explain the process that happens when we exercise. So first of all, for those of you that are not actually familiar with what happens with after we eat, and let's say all those carbohydrates we eat, now they turn into sugar in our blood. Our body will secrete, our pancreas will secrete insulin, which is a hormone that will travel into your blood and acts like a key at the door of each cell to open that cell for the sugar from the blood to go inside the cell to fuel it. Somebody with diabetes, this process is not working very well. So they might be insulin resistant, or they might have a decreased secretion of insulin or insulin production, or can be both. So what happens, you eat some carbohydrates, and again, either your pancreas won't have enough insulin to pump to help this facilitation, or your pancreas may have enough insulin, but somehow your cells are not responding to the key. It's the wrong key, and the insulin cannot open the cell door. So what happens is that the sugar stays in your blood, your pancreas will secrete more insulin, not knowing what's happening, and it's this kind of vicious cycle that your cells are not getting the sugar they need, and your blood sugar is higher than it should be. And this is what we call insulin resistance, because the cells are resistant to insulin. They don't recognize it as the key. So what happens, and why I explain this, is that when you exercise, the muscle cells in our body, so when you contract muscles, your muscle cells are the only cells in our body that have the ability to get the sugar from your blood inside to fuel that muscle cell without needing the key. There's no need for insulin. And when you have diabetes and your insulin is not working, or your cells are resistant to it, that's wonderful, because this is your ability right now to lower your blood sugar by exercising that muscle. So muscle contraction will do that. And exercising regularly is an important component of controlling blood sugar. Very important. The last one would be to control the amount of carbohydrate consumed in each meal and spread those throughout the day. As I said, it's one if you eat a big bowl of rice with not many buffers, and it's one if you eat a smaller amount with more protein and more fiber from vegetables. So it's the same carbohydrate. Let's say it's white rice, not even brown rice. So it's very important to spread your carbohydrates evenly throughout the day, so not eating a huge amount at once. Sometimes when I meet with people, they say, well, on a low carbohydrate diet, how many grams of carbohydrate should I have in a day? And I don't like to answer this question, because even if I say 150 grams a day, which would be lower, right? Would not be too much. The most important is not how much you have in a day, but if you have, let's say, if you don't have any with a meal, but you have 150 in one meal, that's still not going to help you to control better your blood sugar, because at that point you're going to spike quite a bit your blood sugar. For diabetes, we want about 45 grams of carbohydrate per each main meal, and only about 15 grams carbohydrate per snack. So in a day, you could have, if you have 3 meals and 3 snacks, let's say you can get up to 130, 150, but the most important component is to spread them evenly. For blood pressure, the second main cause of CKD, we have a goal of less than 130 over 80 millimeters. I forgot, Patty, can you help me? Is the mercury, I completely...
Millimeters of mercury?
Yes, millimeters of mercury. So that's kind of the measure for blood pressure, right? So it should be less than 130 over 80. How to manage, in terms of how to manage the blood pressure, we have definitely, again, take medications as prescribed by your doctor. Check your blood pressure regularly. A lot of times people choose to have those at home. You know, there are different machines that can easily help you monitor your blood pressure on a regular basis, or at least try to do it often at the doctor's offices. Exercise regularly. Again, exercise is not only good to lower your blood sugar through the mechanism that I just described, but also it's very directly correlated with exercise. So the more you exercise, the lower the blood pressure gets. Manage stress. We know that when people have a lot of stress in their life, blood pressure goes up. Managing stress does not, sometimes people ask me like, how, well, I can't stop the stress. I don't want to be stressed, but things are happening in my life, and we all know that expression, life happens. So it's not about stopping the stress, because we can really do that. It's more like finding ways to respond to it in a healthier way, you know. So it's more like working with your own self to figure out, how can I respond to this in a way that doesn't affect me or my blood pressure as much. And sometimes you might need to talk with someone, you know, you might need not necessarily a therapist, but it can be a friend or family member, or can be a professional that can help you actually to figure out healthy ways of responding to the stress in your life. Another measure, diet-related, that can help with blood pressure control is reducing sodium in your diet. And probably you heard about this, is a classic thing. What happens is that the more salt we have in our body, salt likes water and will retain more water. That can actually increase blood pressure. There's another mechanism how blood sodium, extra sodium in your diet, or too much sodium in your diet will affect blood pressure. In time, too much sodium can actually affect the artery lining, and they will make your arteries stiffer, not that flexible or elastic, so they become stiffer, and because of that, you're going to create more pressure into your blood vessels. Think about, I like to always make this analogy, think about the pressure of water at the end of a hose. The hose doesn't have flexible elastic walls. They're quite hard, stiff, and that's how you have pressure at the end of the hose. So it kind of happens the same. The stiffer our arteries get, the more pressure we build in our arteries. And then we have DASH diet, which stands out for dietary approaches to stop hypertension. And was a diet designed with the idea in mind to actually control your blood pressure with less need of medication or on top of the medication. It's been working pretty well. It's very effective. What basically this diet has, it's a more plant-based diet with less saturated fat, less animal products, less sugar and added sugar, just more fruits, vegetables, legumes, whole grains, nuts, and seeds. Those are the high fiber foods, and they're all plant foods. And then if you have less sodium also in your diet, most people that eat like that eat more whole foods, less processed foods, and then naturally you're going to have less sodium, because about 75% of the sodium in our diet comes from processed foods or packaged foods, you know, foods that are not necessarily cooked from scratch. It doesn't come from the salt shaker as much. So less sodium and more potassium, magnesium, calcium from all those plant-based foods. That apparently seems to be the perfect balance to help you manage your blood pressure. With stages of CKD, I wanted to ask Twin if she can have a poll. I wanted to kind of talk about the stages and ask the participants that we have today what stage they're at if they have CKD or a family member has CKD, because I would like to know also for the future lectures when the nutrition advice, it's a little bit different, right? And I want to know if we have more advanced chronic kidney disease people participating or less of the ones that are more advanced.
You got it. A poll is being launched right now.
Okay, great. Thank you so much for that. And meanwhile, as we're having this piece of information, as I said, the GFR, which is the glomerular filtration rate, is the rate at which each kidney filters the blood per minute. You know, like how fast. Obviously, the faster, the more blood you filter per minute, the better the kidney function is. If you have a slow rate, that means your kidneys are not functioning as well. I'm trying to look at doesn't seem like the poll is moving anymore, so maybe I should just end it.
Feel free whenever you think it's
okay,
ready.
Because I didn't know how much time to allow. It's almost a minute since you launched it. Okay. So it looks like about 27% of the ones that answer are stage 3 and just about 9% stage 1. So it doesn't seem like we have, there are a lot of you that have just maybe they're at risk or have family history, no CKD, but high risk, you know, because of associated conditions. So it's good. That gives me an idea, basically, like how to guide my conversation, even though today, as I said, we won't go into a lot of detail about the kidney, but it still helped me to kind of figure out how the split is among participants. Okay. So not, it looks like there's nobody that's necessarily more advanced kidney disease, which is great. I'm happy to hear that. So going back to the GFR, again, is the rate at which you filter the blood per minute, and the faster the rate, the better the kidney function. So it's a formula. We're not going to get into that. You know, the blood creatinine is it's actually taken into consideration when we calculate the GFR, but normal GFR can be between 90 to 120. So before at the blood, when you used to do labs and part of that comprehensive metabolic panel, the GFR, if it was more than 60, was considered normal, and they would not give you the exact number. Nowadays, the labs will give you the exact number. So, you know, let's say you're 80, which is more than 60, but you may still be, you know, kind of stage 2, basically. Even though before that would have been considered normal GFR. Kind of moving forward, I wanted to show you this slide from the National Kidney Foundation with stages of chronic kidney diseases. So stage 1 would be kidney damage with normal kidney function. So this is when your kidneys are basically, you have 90 to 100% of your kidney function. This is normal kidney function. So 90 or higher would be basically normal kidney function. But again, at this point, why they say kidney damage is that sometimes people may still have that protein in the urine, even though the GFR looks pretty good. And that still is a you know, like showing us that you are at higher risk to develop CKD later on. Stage 2, it's kidney damage with mild loss of kidney function. So it's like 89 to 60, your GFR, and your percentage of kidney function is 89 to 60%, right? That's kind of translates those numbers. Then we have stage 3A and stage 3B. So 3A would be mild to moderate loss of kidney function, 59 to 45. Stage 3B would be moderate to severe loss of kidney function, and that would be 44 to 30. Then we go into stage 4, that's severe loss of kidney function, 29 to 15. And then stage 5, which is kind of what we used to call end-stage kidney disease. That's basically kidney failure. You have less than 15% of your kidney function remained. And a lot of times people kind of get prepared to start dialysis. And the stage 5, as I said, the options you have at that particular stage would be hemodialysis that happens basically in specialized centers of hemodialysis. You go about 3 times a week. You're hooked up to a machine that filters all your body in your body a few times to kind of remove the waste because your kidneys are not able to do that filtration anymore properly for you. And it really affects the quality of life. Think about going 3 times a week for several hours and being hooked to a machine. Then you have peritoneal dialysis that again removes the waste from your kidneys, but it's more like for people that travel or have busy jobs, and you could potentially do it yourself, or if you have a caretaker, so you can do it at home. And it's through the peritoneal cavity. There's a dialysate substance that kind of goes inside your peritoneum, and that will help remove the waste, and that would be eliminated through that catheter that's placed in your abdomen. So, and then the third option would be a kidney transplant. So those, as you could see, kind of at the end stage kidney disease, the options are limited and definitely can affect the quality of your life. Ways to prevent and manage CKD would be increased physical activity, either with, if you need help from PT, sometimes people need to make sure they're not getting injured, but activity again helps your blood pressure, helps your blood sugar, and kind of ensures that the oxygen goes to all the organs in a more effective way. They can oxygenate better your kidneys too. Limiting sodium, especially if you have high blood pressure, but regardless, it's a good idea just because, as I said, the long effect of the sodium on our arteries are becoming stiffer. It's important even for people with not necessarily having high blood pressure to still limit their sodium. Control blood sugar, quit smoking, and reduce alcohol consumption if you feel like your alcohol consumption is more than moderate. The definition of moderate would be 1 drink a day for women and 2 drinks a day for males. So no more than that, right? The definition of a serving of alcohol: for wine, it's about 5 ounces. For beer, it's about 12 ounces. And hard liquor would be just a shot, 1.5 ounces. So reducing alcohol and quit smoking, those again can have positive effects on your blood vessels, on your blood pressure. And modifying diet, more to come. Again, I kind of gave you an idea of if you are more early stages, what, and you have diabetes or high blood pressure, what to do and how to adjust your diet. But again, there might be further restrictions on protein, sodium, phosphorus, potassium if you have more advanced kidney disease. The benefits of nutrition information, I wanted to kind of make it clear. Sometimes even in the medical community, this is not pretty well understood or perceived. The research shows that medical nutrition therapy, so all those diet changes, will have a role in slowing the progression of CKD. It can help delaying the need for dialysis and improving nutritional biomarkers. We've worked one-on-one in our offices as dietitians with people with chronic kidney disease, and we've seen those benefits of people just kind of slowing or stopping the progression of CKD and maintaining their GFR. Sometimes they are able to improve their GFR. Again, it's not a reversible process. So if your stage right now is, let's say you have a 44 GFR, you might not get back to 120, but we've seen people kind of bouncing to maybe 50, 54, like up to 10 points. We've had actually some cases. And again, it's based on individual basis, but at least we'll stop it or slow down the progression of it. And sometimes you might see an improvement in the GFR too with the diet modifications. The nutrients of concern for CKD in general would be sodium, phosphorus, potassium, protein, and fluids. And again, depending on the stage, those can be way different. For the participants that we have today, I think the most important thing is to exercise regularly, eat more a plant-based diet, reduce sodium, and control your blood sugar if you have diabetes. You know, it's not much of a need to, there's no need to restrict phosphorus, potassium, protein, or fluids if you're early stage and your labs are within normal limits for those. We're gonna get more details next week. I would like to open for questions because a lot of times people have a lot of questions.
Hi, Elena. So there were questions that were posted in Q&A.
Yes.
Patty helped us some by answering them in text, but I think that it'll also be helpful if we read those questions out loud and then Patty's helpful answers out loud also, especially for our dial-in participants. So Elena, if you'd like to help me with that, that'd be great too, because as you're reading out the questions and reading out Patty's responses, you can then also add in anything else that you think from your perspective as a registered dietitian that could be helpful.
This question of how long does a urine test take, is it the most definite test? And Patty said there are a few different urine tests, some quick like a dipstick, or take longer, a 24-hour urine test. So the dipstick is a snapshot and therefore not diagnostic with just one. You know, so it gives you just a snapshot, so you can't really diagnose with just one time. There needs to be a trend and there needs to be repeatable. So let's say you did multiple dipsticks and they're all kind of showing up normal, then, you know, then probably you could diagnose. The 24-hour urine test is more diagnostic, but all urine tests are done in conjunction with blood tests to be definitive. It looks like there's no necessary urine test that just by itself will put a diagnosis of CKD. Am I understanding this correctly, Patty?
Yeah, I think that physicians, healthcare providers will do both the urine test and the blood test to be definitive.
Okay. We'll move to the next one. Do kidney stones relate to CKD? And Patty, and I want to say, Patty is a nurse and working for National Kidney Foundation. I mean, she has so much more expertise when it comes to, especially those questions are not pertaining much to diet. It's just more kind of the medical aspect of CKD and kidneys. And I definitely, you know, she's definitely more qualified than me to answer those questions. And I really appreciate that she did this in advance. So kidney stones increase the risk for developing CKD. And if you have had one stone, you are at increased risk for developing more. It is important to find out if there is a dietary component to your kind of stone. This is something to ask your healthcare provider. From a nutrition perspective, what I could say, the most common kidney stones are the calcium one. There's some oxalate one that sometimes people that are at high risk for that, they might have to watch high oxalate content foods, and spinach would be an example of that. And you could search on Google high oxalate foods and come up with the list of foods that are the highest in oxalate. But again, a lot of kidney stones are not oxalate based, so just kind of avoiding eating spinach, for example, if your kidney stone was more calcium based, may not be helpful. So once you had a stone, a lot of times people can save it, and they can, or the doctor is able to say what kind of kidney stone you had, but sometimes people don't know. If it's a more calcium type of, I've heard people just saying I need to avoid eating calcium. So eating calcium from foods would be still important to do to protect your bones, and won't put you at high risk to develop those calcium type of kidney stones. But I would be very careful with the supplements. So I won't take a lot of calcium supplements, or at all. I will try to get calcium from my diet. So that's the only thing that I could say or add to that question. Another question would be, at what stage do you start feeling pain when your doctor pats strongly on your back to check kidney sensitive? Patty responded, the symptoms of kidney disease are varied and can be very vague. So it's not possible to say when this would be true, or even if that sensitivity is a result of kidney issues, without further testing. So blood and urine to confirm that it is a kidney issue specific. As you will see on the list at this link, it isn't listed as a common sign. So best to keep in close contact with your healthcare provider to monitor your kidney health. So, and I went through the symptoms and pain. It doesn't seem to be necessarily the symptom of CKD. So maybe there's other things that you need to check. Somebody asked, how do UTIs relate to kidney disease? What if you had many as a child? If there's a relation later in life, is there any research on this? Patty answers, the basic answer is that UTIs do not cause kidney damage, as they can usually be treated successfully without causing kidney damage. They may be caused by other things, like enlarged prostate in men, for example. A kidney stone can lead to kidney damage if the problem is not corrected and infection continues. Here is the info on UTIs, and we have another link. I'm not familiar with the research on childhood UTIs and their effect later in life, and that is an excellent question for your healthcare provider. I will see what I can find and send an update to you. Make sure you leave your email in the chat and note you asked this question. Thank you. So that's Patty's answer. And another question was about interstitial cystitis, which affects the bladder. Can that have adverse effects on the kidneys as well? Full disclosure, I am an, Patty responded, full disclosure, I am an RN, a registered nurse, not a doctor. So of course, your healthcare provider is your best resource. I found this resource helpful at Harvard. So we have the link here, which mentions kidney disease as one of the diagnoses that is eliminated when trying to make the diagnosis of cystitis.
So I just did a little bit of research. I have not ever heard of anyone having their cystitis damage their kidneys. Not to say that that doesn't happen, but I don't think it's common if it does. The research that I found is the connection is that cystitis is very difficult to diagnose. And so they diagnose it by eliminating other things. And one of the things they eliminate is kidney disease. So if they eliminate all the other issues that might cause urinary tract pain, then they would give a diagnosis of cystitis. So that's and I also gave this person my email so we can be in connection for further questions.
Okay, thank you so much for clarifying that. For the first question, are there natural unprocessed foods that I should avoid? So natural unprocessed, that means like whole foods, right? And I would say, again, likely if you are an early stage of kidney disease, you know, there's no food restrictions or foods that you need to avoid. A healthy dietary pattern, the way I describe, it's more like a plant-based my plate model of eating. The visual is basically half of your plate to be non-starchy vegetables and the other half of the plate to be split in between half. So a quarter of the plate to be the starch and a quarter of the plate to be the protein. Ideally, again, most of the time, try to have a complex, healthy starch or carbohydrate, the way I said, you know, a whole grain, a starchy vegetable with fiber like legumes or potatoes. And then the other core of the plate to be the protein, which a lot of times can be an animal product like fish or poultry or red meat, eggs. But the ratio on the plate is important because it kind of gives you a lot of good nutrients for managing blood pressure, not a lot of carbohydrate and a lot of fiber from vegetables to manage blood sugar. So that would be a healthy diet pattern for somebody with CKD's early stages. However, if you are more advanced stages, yeah, the potassium from a lot of fruits and vegetables at one point may be too much.
Hi.
Hello.
I suffer from diabetes since 2013, and last year I have CKD, but my HbA1c was 5.7. But my doctor said because you're low sugar that happened. Is that right?
So I'm not sure if I understood the question. So you said you have a diagnosis of diabetes, but your hemoglobin A1c, it's pretty well controlled in the pre-diabetes range of 5.7. Do you have also, I was not sure, I didn't understand if you have also CKD.
Yes, I have.
You have. And what did your doctor say? What was the question?
He said because my low sugar that happened. My CKD happened.
So the CKD happened because of your low sugar?
Yes, he said that. Is that right?
No, I mean, contrarily, when you have diabetes and your blood sugar is well controlled and your hemoglobin A1c, it's in the pre-diabetes range of 5.7, actually, that will put you at less risk of developing CKD or having progressing CKD because your blood sugar is well managed. So let's say if you develop CKD at a time that your blood sugar was not well managed and now it's 5.7 because you manage it better, this will ensure that, you know, your CKD won't progress further. Does it make sense?
No.
No.
Thank you.
Yes, you're welcome. So I'll try to kind of answer again. So the lower the hemoglobin A1c for someone with diabetes, the better. The better protecting for CKD or CKD progression. So the fact that you're having a 5.7 hemoglobin A1C will show that you're doing the right thing for your kidneys and should not be the cause of your kidney damage. There might be other factors, there might be other pieces of information that we don't know, but what I'm trying to say is that if right now your hemoglobin A1C is 5.47, I would try to continue controlling my diabetes as well as right now to prevent progression of CKD since you have it already. Yeah, so in terms of to finish the question with the natural unprocessed foods that I should avoid, again, for early stage, there's no such a thing. We just want people to eat a healthy kind of diet pattern with the majority of foods and nutrients coming from plant foods without restricting. However, if you're more advanced stage, sometimes even the plant foods can be restricted. But that's just on an individual basis. When people have elevated blood levels of potassium or phosphorus, and we can go into more detail next week. We have the second question. My mother fainted and found out she has had stage 4 CKD afterwards. Is this something nutrition will help protect against? So at this point, again, nutrition, since your mom was diagnosed already with that, and you know, again, the nutrition likely will help for your mom to stay at this stage 4 and not progress towards stage 5. Again, we can reverse it. As I said, for some people, when they change their diet and their lifestyle, there's some increase in the GFR, but it's not going to bounce back to stage 1, or likely would be just like a little bit of an increase, if that. But the main goal right now is actually to avoid having the CKD progressing further. Another question is, I know it's not simple, but which of the ways to prevent slide would be the most important? Oh, you mean for the controllable factors?
This question came in sort of at the end of your presentation, where you had a slide that showed ways to manage or prevent CKD, and it was sodium, control your sodium, exercise. It was a later slide.
Okay,
so
sorry about that.
That might have been
ways to prevent. Okay, now I know the slide. Yeah, I mean, we don't know exactly which one is more important. I would say, I mean, it depends also, like, for example, if you have diabetes, probably one of the most important for you is to control blood sugar. Or if you have high blood pressure already, the most important thing is to reduce your sodium. And also would be based on how your diet is right now. Let's say, well, I'm not eating a lot of sodium, I'm cooking from scratch, or I'm not eating processed foods. So reducing sodium may not help you much, right? But if you have a diet high in fast foods and have high blood pressure, obviously for you at that point, the most important thing would be to try to reduce sodium in your diet and cut back on the sodium intake. Again, if you don't exercise, increasing physical activity may be the most important thing you could do. So I think it's based on what is the underlying condition that contributes to chronic kidney disease, and also where is your baseline? I mean, are you doing any of those things, or you're kind of, as I said, you're sedentary, but you know now that activity can help you. So a good measure and a factor that would help you quite a bit would be to maybe start walking a few times a week, you know, so just to be more active. The next question is, what is your view of intermediate fasting, or maybe intermittent fasting, and the modified ketogenic diet? My morning fasting sugar has tended to be high, and I found intermittent fasting has been helpful when I do it. So this is a good question, and those are kind of more dietary trends that are a little bit newer. relatively newer, but still new in the sense that the research studies that are done on intermittent fasting and the modified ketogenic diet are not showing clear results to say, well, me as a dietitian that I'm practicing science-based only, I can say to everyone with CKD or diabetes, try to do intermittent fasting or try to do ketogenic diet modify because it's going to help you. The research kind of is a little bit, there's some mixed results, and we still need more research to understand how we can create this a more structured recommendation. What I can tell you, and I know I talk about eating in the first hour of waking up and regularly after that. However, if you notice that when you do that, your body responds well metabolically and your blood sugar is better controlled than before, I would continue doing it. And that's but at this point, we cannot have a clear recommendation that we can give to everyone. So maybe metabolically you are different than somebody else, and this intermittent fasting may now work for another diabetic. So I would say if you test it and it works for you, I think it's fine to continue doing that. And there's more data that we get from those research on intermittent fasting, and it's quite interesting, but it's not definitive at this point. Is drinking 8 cups of water can reduce kidney disease? I'm not aware that that's necessarily a way that, I mean, I think adequate hydration is an important component of kidney health because we need fluid. Our kidneys filter our blood and make urine. And obviously, we keep saying that the color of the urine is a good indicator of how well hydrated your body is. And the more yellow, the more concentrated, that means you have less water and more waste products in your urine, right? When you don't drink enough fluids, your kidneys will have to recycle the water more to keep it in your body and in your blood, and basically will excrete less water. So the urine is going to be more concentrated. And it's been shown that that can potentially not be that well for the kidneys, but I'm not aware of I don't think that necessarily just by drinking more water, you would prevent CKD development. I think ensuring that you drink up to 8 cups of water or fluid every day will help keep your kidneys healthy, but there's no reassurance that if you drink that, you're not going to get CKD from what I know. And I hope that answers your question. It looks like we don't have any open questions.
Right. Well, thank you everyone for attending our first of 3 classes led by Elena, our clinical dietitian. Again, this is the email address that is where you can direct your questions if you have any more.
And I hope to see you virtually all next week, right? For the second part, that would be more focused on nutrition. I'm happy, and thank you so much for taking the time to be hooked to a computer today and participate in our presentation.
I think that we have a person raising their hand, so I'm going to unmute them.
Hi.
Hi.
I want to ask, my blood HB was 8, and I take injection of Abrax and become 11, but after a few months become 8. Why is that?
I'm not sure I'm clear on the question.
My blood HB was 8, and I take injection of Abrax.
Okay.
My doctor give me Abrax injection to raise my blood. But after that few months...
Oh, your red blood cells?
Yes.
Okay, this was the part that I was clear on. And then you said that it was 8 and you got that injection, and then what happened?
Rise to 11, but after a few months It's back to 11, to 8.
So it dropped again, basically.
Yes, it dropped again.
I feel like this is more like a doctor's question that doesn't pertain much to nutrition. And I'm not sure, I mean, I don't think I can answer it properly. Did your doctor talk to you about it? Did you ask your doctor when that happened?
When he see that, he gave him more injection. I did ask him. He just gave me more injection of Ibrox.
As a way to kind of help your body to have enough red blood cells on a regular basis. Did you have that conversation with your doctor? Like, how often do you have to have this?
No, I didn't ask him.
That would be something to ask because, as I said, I can't really. Yeah, I can't really answer that question about the medication and how. I mean, I don't know your personal medical history to even be able to make a comment. So this is definitely a question to ask the doctor and talk with him about, like, why is this happening? I need to understand, maybe understand a little bit more about that, what that injection does, and how often you have to have it, and you know.
Yes, thank you.
You're welcome.
Well, I think that it's safe to stop questions right now. But thank you so much for thoughtful questions and thoughtful answers. I really appreciate everyone's participation and just being here today. Elena, Patty, is there anything that you two would like to add before we sign off?
No, just encourage you to include your emails in the chat so that you can get all the resources we talked about today. Thanks so much.
Yeah. And I would hope, as I said, to have you guys back next week to talk more about nutrition, because that's my that's my field of expertise, and I would love to get in more details. And I think our third, actually, I'm excited because our third class is more like hands-on and tips of how to. You know, we talk about what would be good for diet and this plant-based diet, but how do you get there? How do you make those changes? How do you incorporate those in your life? And this is kind of the area that I'm more passionate about it, because this is kind of what I do most of the time with people that I work one-on-one. So I would love to share that with you too.
Absolutely. Thank you, everyone. Make sure that you are here again for next week's second class. The information that you have in your email or the link to access any later meetings will still be in use. You can use the same ID. So there's nothing that changes. So I hope that in that, it makes it easier for you to return, and please feel free to share with your friends and family.
Thank you.
All right. Thank you so much, Patty. Thank you, Elena.
See you next week.
Bye-bye.